Conjunctivitis, eye flu, or pink eyes. With persistent rains, we are seeing a rapid surge of conjunctivitis cases across India. Some people say that it can affect only kids. Few people believe that it can spread by looking at the infected person's eyes. And few also feel that one needs to be in the dark room without any kind of lighting till the infection is treated. Is that all true? Let's check out. In this video, I am sharing all the information that you need to know about conjunctivitis. Conjunctivitis, commonly known as pink eye, is a highly contagious eye infection. It can cause discomfort and inconvenience to the affected person. So, taking proactive measures to prevent the spread of conjunctivitis is essential. Conjunctivitis is not new, it happens every monsoon, but this is the first time where it is happening on this scale. A common eye ailment characterized by inflammation or infection of the conjunctiva, the clear membrane surrounding your eyelid, and a portion of your white eyeball. This condition may result from a number of causes, including germs, viruses, allergies, or poisonous chemicals. There are three main types of conjunctivitis, which is allergic, bacterial, and viral. Allergic conjunctivitis. This kind of conjunctivitis results from an allergic response to environmental allergens, including pollen, pet dander, dust, or mold. In addition to swollen eyelids and excessive weeping, symptoms include itching and redness in the eyes. Bacterial conjunctivitis. It is brought on by germs like influenza, pneumonia, etc. Redness, itchiness, and discharge from the eyes, which may be yellowish or greenish in hue, are some symptoms. Viral conjunctivitis. Viruses, including adenovirus or any other type of viruses, are responsible for this type of conjunctivitis. The signs and symptoms include fever, pain, and other flu-like manifestations such as redness, irritation, and watery eyes. There is also another type of conjunctivitis, which is chemical conjunctivitis. Exposure to chemicals like chlorine or detergents is a reason for this. Along with excessive tears, symptoms include redness and stinging in the eyes. One of the hallmark symptoms of conjunctivitis is the pink or red discoloration of the white part of our eyes. Conjunctivitis can cause a discharge from the eyes, which may be watery, sticky, or thick and yellow or greenish in color. The consistency and color of the discharge can vary depending on the cause of the infection. People with conjunctivitis often experience itching or irritation in the affected area. This can lead to frequent rubbing of the eye, which may worsen the condition. In some cases, conjunctivitis can lead to photophobia, which is an increased sensitivity to light. People with this symptom may find bright light uncomfortable or painful. If this condition is neglected, it can affect the cornea also. In that case, it can cause blurred vision. So, in case of any such symptoms, please consult your doctor and only then start any kind of medication. Do not take any over-the-counter medicines, as they might give steroids at times, which can further worsen the problem and might cause serious concerns. So, consulting a doctor and using only prescribed medication is very important. Your doctor might suggest some lubricating drops and antibiotics also, because eye flu is a viral infection, and when your eye is infected with a viral infection, then your eye's immunity is lowered. So, there is a high possibility that it can get infected with other bacterial infections also. So, to make sure that the eye is not affected with any secondary or added bacterial infection, antibiotics are prescribed. Usually, the treatment might take around 10 days. During this time, it is also advised to wear black glasses to protect the eye from any kind of direct light and also to avoid touching it frequently. This infection is not spread by looking at the infected person's eye. It is spread by fomites, which means eye infection. If the infected person touches his eyes and touches any common surface, and a non-infected person touches the same surface and then touches his eyes, that's when he too is infected. Similar to COVID. If you're an adult and you're infected, then you might need to take at least 4 to 5 days of leave from your office, as in the initial days this infection is highly contagious and the discomfort also is very high. When it comes to treatment, eye hygiene is very important, as there will be eye discharge in this case. So, it is important to clean it regularly. Ideally, it is recommended to wash your eyes with cold water, but I would not suggest you to do so because at times the water we get in our taps is not always safe for the eyes. So, if you can arrange for clean water, then you can wash your eyes with cold, clean water. Or you can clean your eyes with clean eye tissue and throw them away. Do not reuse it. If you need relief from this situation, then you can definitely use cold compress. For this, you can use a clean cloth and put some ice in it and gently dab on your eyes. Usually, if one person in the family is affected, then there is a high probability that the other family members or colleagues might also get infected. In such situations, make sure that the infected person's things like clothes, towel, bed sheets, etc. are kept separately. In a way, quarantine to make sure it is not spreading to other family members. Now that the infection cases are increasing, most of the people take some kind of medications or antibiotics as a precautionary method. Please don't do this. Do not take any medication unless prescribed by the doctor. Also, in most of the cases, the infection is only in one eye. So, there is a possibility that it can spread to the other eye also. Unless it spreads, do not start any medication beforehand, not even the prescribed medication. The main precaution in this situation is not to touch your eyes frequently. It is also rapidly spreading in schools. So, if your child is infected, then it is best to make sure that the child is at home until he or she is completely recovered. Teach your child about proper hygiene practices, including hand washing, avoiding touching their eyes, and not sharing personal items like towels and pillows, etc. Emphasize the importance of covering their mouth and nose when sneezing or coughing to reduce the transmission of germs. Ensure your child's hands are clean before they are touching their face or eyes. Teach your child not to rub their eyes, as this can worsen the infection or spread it to other parts of the eye. There is a myth that you should be in dark places and should not be exposed to any kind of light. Refrain using your mobiles and computers, which is not completely true. As far as you are comfortable using your mobiles and computers, you can certainly use them. It is just that you should be away from light which is harsh on your eyes. Find using your devices comfortable, then you can certainly use it by adjusting the brightness. It is important to note that there are different types of conjunctivitis, including viral, bacterial, and allergic conjunctivitis, and each may have slightly different symptoms and causes. So, it's crucial to visit your doctor for an accurate diagnosis regardless of the type of conjunctivitis you have, so that the right therapy may be administered. So, this was some information about conjunctivitis or eye flu. If you find this information helpful, do share it with your friends and family to increase awareness. And don't forget to hit that like button and subscribe to my channel here for more such videos. Take good care of yourself, and I will see you in the next video at Rivaafoodz.